Kid. Hi, everybody. I'm Martin Devon with the Western Health Information Network. And I know what you guys are thinking. How did I get to be so lucky to talk about a topic as sexy as a voluntary health ID? Now, when you're a speaker, you get one of these little blue things at the bottom of your name tag. And as I'm sitting at lunch and waiting in line or just visiting with people are asking me, so what do I speak about? And I would tell them that I'm talking about the Voluntary Universal Health ID. And everyone said, well, that's really interesting, which is not what you would think. But with a crowd like this that's really interested in making a difference in transforming healthcare, it actually is a very sexy topic. So, what's the issue that we're really dealing with? Well, for those of you familiar with HIE, you really know that identity is the Achilles heel. It's the issue that we deal with. If you can have all of your health records in one place, that's wonderful. But if you think to yourself about the issues you have within your own health records or your dealings with banks or your dealings with anything else, you know that databases get a little bit messed up. And even though we have literally rocket scientists working on master patient indexes and coming up with really brilliant algorithms, you still have 10%, in some systems as high as 20%, of records that don't match. So we can spend all this time and connect clinics with doctors, with hospitals, and be able to talk between let's say us and Redwood MedNet, and we can do all of these wonderful things. At the end of the day, if your physician has to figure out who are you and which records are relating to you, it really doesn't have the same level of value. I'm just having a hard time reading that slide, but I wish I had glasses like Sajid. So we have some of the common issues that you have to deal with is, if you've got someone who's got a common name, like a John Smith or a Mary Rodriguez, in certain areas, the same name will come up over and over again. And it's really difficult for a provider to figure out, who is that person. If you think to yourself, in your own history. So, I'm Jewish, and I grew up Orthodox Jewish, and my Hebrew name is Mordechai, and that's my middle name on my driver's license. And there are some records. Sometimes I went to a hospital or a doctor's, out of area, and they just saw the second name on my driver's license. So I've got some records that say Mordechai Devon, and there's no way a doctor's going to be able to figure that out. For those of you that got married and changed your name, you know how difficult it is if you had an issue or you had a lot of health records before you got married, and then you moved and you went to a new doctor. So being able to link all that up, you can come up with some smart algorithms, but really there's only so much that you can do that's going to solve that problem. And then for those of you that are serving the safety net, this is not a surprise to you. But one of the big problems that we have is the homeless population. When they get health care, a lot of times what they put down for their residents is the clinic, the homeless shelter that they're at. So you get people who have the same name and the same address, and they're very prevalent in particularly the safety net. And so these are all really substantive problems that are difficult to solve. So what did we want to do about it? Well, the vision, and talk about sexy. I mean, there you've got your voluntary health ID right there. And I've got to give all credit to the Robert Wood Johnson Foundation. They're willing with their Pioneer Grant, their Pioneer Grants, they're willing to try and solve problems that are going to really transform a problem, even when it's not clear that something is going to work. And as we go through this presentation, I'll try and give you a sense of what we're trying to do to make this happen. But it's not one of those ideas that it's immediately clear is so easy to solve. And they're willing to fund us to be able to do a project to really test it out and see, hey, can we use a voluntary health ID to solve this problem? So if you think about what some of the barriers that we have to using ID, and for those of you, maybe I should just go through this. The idea behind having a health ID is that if you've got a unique ID, you've got it on a card, you scan it, every time you do an encounter with a health system, that unique ID is going to allow you to link the records. So if I came with my card, when someone wrote it down that I'm Mordechai Devon as opposed to Martin Devon, or a homeless person comes with their card, it doesn't matter that they've got the same address to somebody else. It's pretty clear the records get linked. And that's the idea behind the universal ID. But if you think about some of the barriers, they're all over the map. In the United States, culturally, for very good reason, we don't want identification. There's, the whole idea of having a national ID card and having, the government know who you are or someone know who you are is not something that people are, too excited about. Other barriers include trust. Trusting that, okay, so I understand this is not a government-issued ID, but I really want to trust that this is going to be properly administered. And I see that even though this is such a sexy topic, I'm running out of time, so I'm going to have to go a little bit more quickly. Okay, so the approach that we took is that we're going to crawl, then walk, before we run, and then eventually fly. There's no magic wand or magic algorithm that we can use. So this is how it works for the patient. They register with our application and request a universal health ID, and we issue it to them. Then every time they go to a healthcare encounter, I think we're missing a slide here. So they bring this card with them every time they go and try and get some health care. And the result is, I just can't see this. The result, if it's working well, I'm just going to talk through it. If it's working well, the result is that it's invisible. They hand in the card, and they don't experience anything other than their records are correct. All that they see is that their doctor knows who they are, and the doctors, instead of seeing 10 lines for medical records, they just see one, and that's as it should be. I've got a couple of screens that just show you what they look like, the application to register it, but I don't think we've got time for that. And so what we've done so far is we've built the identifier infrastructure. Our partners GPII have built servers, and they're able to issue IDs. We've built an application that's allowing us to capture this. We are currently integrating it together with our master patient index so that our HIE can handle it when providers give us a voluntary health ID. And we're currently in conversations with 4 clinics who are going to be the pilot site, who are going to try it and see how it works. And the idea behind this is that we're going to see what works and what doesn't work. We're going to have to tune our literature. For those of you that saw the presentation this morning, there was a little bit of video that explains how we're going to transform healthcare. So we're going to do similar things like that within the clinics to educate people about what a voluntary ID is and how it works. And then we're going to dump the stuff that doesn't work, and we're going to expand the program and use the stuff that does work. And that's all, folks. Thank you.